All right, so welcome everyone to our fourth and final mental health ambassador training. We're so excited to have you here, and we're excited for Micah Harrell to do her presentation. But what I asked Destiny Cravens, our co-lead for mental health ambassador, to do is just to share a little bit about some of our current initiatives and the process so that you guys can have a sense of that. And we have opened it up for you if you would like to join one of our current initiatives. We welcome that, but you must speak with that individual group first before doing so. And you also need to, when you do your submit your proposal, it must include specifically what you are going to be adding to it. So it can't just be, I want to, help them expand what they're doing with X, Y, and Z. It'll be, I'm going to expand what they're doing, but I propose expanding what they're doing by X, Y, and Z. I've talked with them about this and they agree that that would be something good for us to do. So Destiny, you are a co-host and take it from here.
Okay. Hello, everyone. Like Dr. Lindsay said, my name is Destiny Cravens. I'm a junior majoring in psychology and sociology, and I'm one of the co-leads for MHA alongside Sarah Avery, who couldn't be here today. So if you see me looking down, it's because I have a ton of notes to go over. So the first thing I want to say is just thank you all for being so dedicated to this program and coming to all the trainings thus far, completing any makeups and stuff like that. Your dedication is definitely appreciated. I've heard so many good things about you from Dr. Lindsay, so I can't wait to get to know each and every one of you as the process continues on. So before I go into some details about the projects we have now, I do want to give you all an update on the process of Health Ambassador. So I want to offer some reminders. So first, the proposal is due, yes, which is next week, next Friday, at 9 p.m. And each group will submit one proposal. So I just want to highlight and make sure that whoever submits it on time, because if it is submitted late, it won't be accepted. So when you do form your groups, make sure to have someone who has good internet access and things like that submit it early, and don't wait till the last minute to do that because it won't be accepted if it is late. Also, you all should receive an email no later than the 25th of November with a link, a Sign Up Genius for interviews that we'll be conducting. So it will be a group interview and it will be about 30 minutes long for each group. And I'll put the dates in the chat after I finish speaking, but these interviews will take place the 14th, 15th, and 16th. So make sure to check with your group on when you're all available to meet and interview with us. And in this interview, you will just be providing us all with a description of your event and just also answering any questions we may have about your proposal. We currently have 66 eligible mental health ambassadors. However, we're not able to induct every single one of you just because that is such a large number, which is why we are doing interviews. Also, we have created Padlets for you all to get to know one another and also a Padlet to form groups. And I will share my screen right now to show y'all what those look like. This is the Padlet about getting to know one another. So the person has done it, and then Sarah Avery and I have each done it. So essentially, you're just going to type in, whatever you want to introduce yourself. You can add a picture if you'd like, but that's essentially what it looks like. And then also, there is another project proposal Padlet where you can form groups. And right here, more information on forming groups, as well as all the members and emails who currently have groups in case you want to join one of their groups. So that's the Padlet would look like. I would really suggest using it to your advantage, forming groups through that. We did make it to benefit y'all, so make sure to use it before next Friday. Also, let's see. So I'm now going to give a very brief overview of the social media platforms or initiatives that we have right now. So we currently have 3 main social media groups. We have Bonnie and Kara, who do minority mental health, and basically they focus on disparities in terms of mental health in different identity groups. And we also have Thriving Thursday, which has been a group that's been along ever since the beginning of MHA, and they focus on resiliency. And then lastly, we have Mental Health and Misconceptions and Myths, and they focus on language sensitivity. So I do want to highlight that, like Dr. Lindsay said, you're all more than welcome to join an existing group. However, in the proposal, you will need to submit an email confirmation from those group members saying that it's okay for you to join. And you'll also need to answer a couple questions about what you will be bringing to that existing group and how you'll be improving it. So just keep that in mind. This semester, we are looking more towards presentations rather than social media. You're more than welcome to have a social media proposal, but we are leaning more towards present events, just so we can engage more students. Let's see, and I think that's it for my updates. Now Madeline, who is our presentations lead, is going to give a brief overview of the current presentations. And if you have any questions, feel free to email me or Sarah Avery, and I'll put the interview dates in the chat as well as my email.
Hi, everyone. As Destiny was saying, my name is Madeline Cook, and I am the presentations lead for the Mental Health Ambassadors Program. I'm currently a junior majoring in biomedical engineering, and I have minors in chemistry and neuroengineering. So one of the overall goals of the Mental Health Ambassadors is to promote positive mental health through multiple mediums, as Destiny was mentioning, including our social media, events, and presentations. So each of these categories focuses on 3 main components, either sharing mental health awareness, resiliency, or self-care information to start an open conversation about mental health. So today I'll be speaking more specifically on our presentations and events, especially since with recent events, these 2 have been somewhat combined into one category. So some of our previous presentations expanded on topics such as self-care strategies while at home, healthy versus unhealthy relationships, how to help a friend, and dark humor. These presentations are more of a PowerPoint format setting, and these can be viewed on our YouTube channel as previous traditional presentation guidelines. However, there's also several non-traditional presentation ideas that we've worked on for the Mental Health Ambassadors Program, and you don't have to necessarily follow a traditional format when making a presentation or event. So for example, for a combination of a presentation and event style, we have a wonderful collaboration currently with the UAB artists in residence who host and present events with different artists each week. So essentially each artist will come in and they have a unique specialty ranging from music to comedy, and they use that specific focus to promote positive mental health, whether that be through self-care or talking more just about mental health awareness. So we also have a unique initiative from another MHA group, which is our archive podcast group. And essentially the podcast is designed for listeners to hear personal mental health stories that vary in background and culture. So the main goal of this podcast is just to start a healthy discussion about mental health. And a lot of times this can be something very difficult to have. So it's something that's very personable, and it's just very fortunate that we're able to have this initiative. And all these are wonderful ideas, and we look forward to having future initiatives for presentations and events. So presentations, like I said, can be in a traditional format, and these can be educational based, or these can also be implemented to promote positive self-care. So basically it can be any type of format as long as it is looking for positive mental health, and we're looking for open and new creative ways to promote mental health as ambassadors.
Thank you, Madeline. Was there any more that you wanted to share?
I can talk a little bit more about our events because I'm not sure that Dua is here to introduce herself or not.
Dua, are you here? I know she was going to join, but why don't you go ahead and do that, and I can help add in if needed.
Okay. So essentially, our other category is events, and our event lead for MHA is Dua. And essentially, with events, it's kind of combined with presentations and social media right now. But one of our event groups is Make It Stick. And essentially, they had a tabling event in the spring where people could come out and just learn more about mental health. And now that they implement a newsletter through our social media account. So some event ideas can be to have something over Zoom, kind of more like the artist in residence event, or we're also thinking about doing events more like to bring in like social stuff. So like Netflix parties or like presentation, like get to know you events. So we're pretty open to something as long as it's a way to promote positive mental health.
Thank you. Yes. And there are, as you know, many creative ways to have events now through social media or through, like Netflix, watch parties, or just different things where we can encourage all of our students to get together. What we're hearing a lot is that students are feeling very isolated and, difficulties with motivations. And so I think that Mental Health Ambassadors really has a place to help support each other with this. I also wanted to share about one of our mental health ambassadors, Adi, who is really wanting to support DSS, Disability Support Services, and do a series of events to help support and break down the stigma, share what they do, and do some really special things. We just had a planning call, Dua and Adi and myself planning. And so this right now they're going to sort of do a social media push on what DSS is, what they can do for you, and really hopefully being a platform so that those who may be considering it will know how to do it and what it's all about. And before this spring, and then in the spring, wanting to have a town hall where students can share what they've experienced and how it's supported them, as well as the DSS has a special place where you can take tests. And so putting encouraging words and messages up in the testing location. So there's lots of really wonderful things that we could do. So please just reach out. He would love, because right now it's a team of one. So he would love anyone who's interested in disability support services and breaking down the stigma and supporting with that. So that's another one. And I encourage you, if there's any that you currently know about and see that you would like to really expand what they're doing, that is something we are definitely open to. And again, it just needs to be a specific thing that you will be helping to support it. So mental health leadership, anything else that we should share before we turn it over to Micah?
I put it in the chat, but all the groups and all as well as their emails are in the Padlet. So if you have any questions or want to reach out to those group members to ask if you can join, or even just to learn more about their project, please reach out to them and use the.
Did I mute everyone? It said the host muted everyone. Why did I do that? I don't even know how I did that. How do I unmute everyone? Let me see. I'm going to ask you to unmute, Can you talk, Destiny?
Yes, I can. I finished my point, but yeah.
Okay, so sorry. Let me just, well, raise your hand or put something in the chat if you want to be unmuted. I had another point I wanted to make. Oh, I just wanted to recognize Dr. Stowe, who's here, Director of Student Counseling Services, who has helped co-launch this with Juhi Agarwal, who was an honor student here last year. And maybe if you want to wave your hand, she's done some of our trainings, and so we all know and love her, of course. But just wanted to recognize her, as well as Herbert Wilkerson. I think he's here. If you're here, Herb. Oh, there he is on my second screen. So he's there. If you see him, he just waved for a second. But want to recognize him as well. Herbert Wilkerson, who is a clinical counselor with Student Counseling Services, but, sorry. Oh, no, didn't mean to accept that. But he is also, oh goodness, it's somehow coming up on my TV or my screen here. But he is also an advisor for us and really is helping with our outreach efforts and wanting to us to help increase the diversity of our program. But want to recognize Herb, who attends our leadership meetings and is a great leader for us. So thank you as well. So with that, hopefully I've not forgotten anybody here. But thank you all for joining, and we are so excited to welcome Micah Harrell, Director of Wellness Promotion, and she's got a lot of great stuff to share, I know, and so hopefully you can unmute yourself and share your screen.
It would be great to see if somebody can try and do that, because I do plan to ask some questions and just try and get a little bit of conversation. So is anyone willing to just try and unmute themselves and just say, hey?
You can unmute yourself. You're able to.
Okay. Oh, good. Thank
Perfect.
you. I don't know what happened there, so sorry.
No worries. Well, thank you. Thank you, Robin, Destiny, Angela, and all of the leadership, Madeline, everyone who put this together, all of you for signing up. I am really thrilled to be able to be here. I've only been at UAB for 6 months. And so this is my first presentation to students. So I'm excited. I'm super excited. And it's also my first presentation on Zoom. And so while I was putting the presentation together about giving presentations, I was trying to think through all of the things that you would have to be thinking about and what changed. And I've actually learned a lot, and not all of it made it into my slides, but I felt like we had a lot of slides. And so if there's time at the end, I can talk with you about some of the other things that I've learned. Like, for example, I will tell you, I had planned to do some polls, and I built some polls using Zoom, but those are in my Zoom account, and I've joined this Zoom account. And so the polls don't transfer over. You have to create them in the Zoom link of whoever owns that. So we won't have polls today, but that's an activity that I hope you will be able to include in your online and web-based programming as well. Let me see. So I've been at UAB for 6 months, as I said. This is my first presentation and workshop with students, so thank you for having me. I hope it will be somewhat interactive. My style tends to be to ask questions and hear responses, and then move on from and cover information after that. So I do hope that you will respond. I'll try and keep track of the chat, but Dr. Lanzi also said that she was going to help me with that. So if you want to drop comments in the chat too, I know sometimes it is a little bit awkward. People tend to try and speak all at once, so whichever way you're most comfortable with. I appreciate all of the faces that I'm seeing as you are doing presentations and interacting with folks online. You'll come to appreciate being able to see faces. It's okay to just see names, but when you have a group, it's nice to have a few faces, because just like you would in person, it's nice to just have that energy and that kind of reinforcement of participation and listening. And so thank you. With that said, if there's a time when you need to turn off your camera, absolutely feel free to do that. I've worked in higher education doing wellness promotion for, I was at my previous institution for 12 years. We also had a peer education program there that presented at the National Peer Education Conference for Wellness Peer Educators. And my areas that I oversee here at UAB are the Promoters of Wellness Peer Education Program. And so hopefully many of you are familiar with them. If you're not, I hope you go check them out. check out their social media because that's how they're doing some of their programming these days. And then our areas of focus are predominantly alcohol and other drug misuse abuse prevention, as well as interpersonal violence prevention. And the overlap between those issues and the work that you guys are doing in terms of promoting self-care, destigmatizing mental health, and just general mental health education, there's a lot of overlap. So I actually think that there's opportunities for collaboration between our peer-to-peer group with y'all's peer-to-peer group. So I think with that, I am just going to go ahead and start to share my screen, and we'll get into some content. We'll take a break at some point. I'll just try and keep an eye on the time. But if you need to step away, if you need to do anything, again, just you take care of yourself during that time for training. So I will go ahead and start right here. We go. Okay. Yep, here we go. All right, so we are here to talk about developing programs and presentations. You got a lot of information at the very beginning, and this is your last training before you're submitting your program proposals for the mental health ambassadors. And so I hope that I'm able to help provide some concrete strategies and just more information for how to do some of those programs that you're going to be putting in. The first thing that I want to do is just kind of very briefly go over the agenda. There is a little bit of theory today, but not much. We won't spend much time on that. I did incorporate SMART goals. SMART goals is something that you're being asked to use when you're developing your program proposals, and in order to kind of deliberately identify your goals for that project. So I'm going to very briefly go over that as well. The bulk of what we'll be talking about today are programming methods, ways in which you can be doing programming. And there's more than what I just put on there. There are things like what Dr. Lanzi mentioned that are new and really haven't been utilized as much previously. Things like the Netflix parties where you can watch and then have a discussion about the movies that you've seen or whatever it may be. And so some of those aren't. So this is by no means a comprehensive list of programs. These are just some of the ones historically that have been most common. And then we are going to have some time at the end just to try and practice and kind of brainstorm and put something together really quickly. And then who knows, maybe something will actually stick and you'll be able to put it into your proposal if you don't already have an idea. Or you have a new group, if you're not a part of a group, that all of a sudden can hopefully form. And then, but again, just trying to put some of that, what we're talking about today, into practice. So my first question, so if you guys, want to unmute yourself or put an answer in the chat, intentional program development, right? Intentional. Why is it important to be intentional when developing a program? Oh, and I don't actually think I can see the chat. I just tried to, but it just clicked on my next screen. So
I'll let you know. I don't see anything in the chat yet, but
okay.
Everyone feel free to unmute yourself and share what your thoughts are. Not all at the same time, of course, but.
I think one big important thing about being intentional in program development is that we have limited resources and limited time. And so by being intentional and being knowledgeable about what the needs are within our community, we are able to make the biggest impact with what we have.
Excellent. Thank you, Melissa.
Oh, my name's wrong.
I see one in the chat from Annalise that says intentionality ensures that you're working towards your mission and reaching the people and audience intended.
Absolutely. Yes. You're having intention. You're thinking about who you want to reach, how you want to reach them, and what information is most important for them.
I think that if you're intentional, people are able to see that, and it can make them feel more inclined to follow that information or to be a part of it because they know that you're purposely trying to help them.
I didn't get all of that. Was anyone able to hear that and to summarize that for us?
Can you hear me better now?
I'm gonna lean into my speaker and I can hear you if I do that.
Can you hear me better now?
Oh, yes, much better.
Okay. I think my blanket might have been over it. But I was saying that people are more inclined to pay attention and be a part of what you're offering or what your program is if you're being intentional, because they think and understand that you put a lot of time and effort into this to help them. So knowing that it's going to be beneficial to their lives because you've worked diligently to do that, I think it can be very beneficial.
Absolutely. I think you're right. People can tell when you have intentionally put time and effort into something versus throwing something together, right? They can feel that, they can see that. So that's an excellent point. Anyone else have anything that they want to add? Okay. Well, I think that, I said what I thought was important, and you guys did a great job of saying some of those things too. So intentionality allows you to reach your goals. You have goals because you have intentionally developed your program. So you've identified goals, and then you are methodologically putting together a program that helps you reach those goals. Also, it allows you to create an impact, right? That's what we're trying to do when we develop programs, is to have an impact. And if we are taking the time, we're doing the research, we're vetting it with peers, with our group, we are more likely to have the impact that we want to have. Positive versus neutral versus negative results. And so the goal of any program is to have the impact that you want. And yet we know that at times there have been examples where a program was put together and it had either no results, it made no change, it had no impact, or a worst case scenario is that it could have negative results. It could actually maybe reinforce something that we didn't want to reinforce. And that could be based on examples given, or it could be based on the way in which the presenter handled questions or off the cuff discussions if they weren't prepared in their knowledge base, right? And so we don't want neutral, because we don't want all of the time that we've put into developing a program to have no impact. And so being more intentional will lead to more likely positive results. And then finally, maintaining reputation. And that was what our last comment said, was that, people can tell when you've been thoughtful and you have put thought into the program. And so being intentional, really thinking it through, giving it time and attention really does show when you are then implementing that program. And so all of those are important. And especially if you're developing a program on behalf of a group, everything that you're doing, it trickles back to the way people see that group. And so it's really, really important to make sure that you're putting time and effort into these programs. How has the pandemic changed programming? It's changed so many things in our life, and programming is not immune.
I think it changed it the most in the fact that you cannot do as many in-person, face-to-face conversations, discussions, reaching out to people as we used to. So everything is online.
Yes, there is. Some of the most fun parts of the programming is the person-to-person interaction. And so we can still have that. I'm having that with you now, but it is very different. And so yeah, that is a huge impact for sure, Abigail. Thank you.
Yeah, most of the clubs I'm in, it's very hard to throw a virtual event and get the same attendance. That's probably the biggest hit that most clubs have taken, is attendance. And the main thing is we usually offered food, as like the first level of getting the people at least to the event, and you can't really do that. So that has taken a hit as well.
That's huge, right? So people are being creative. They're having all kinds of ideas, and they are developing virtual events and online programs. But they're having less success with people actually engaging with them in that way. I think the first free hot dog everybody gets, or the first free cookie everyone gets after at some point things get back to a place of normalcy is just going to feel like $1,000, but yes, that's a real barrier. Getting people, you went through all the work to develop it and to think outside the box, but then how do you get people there? Any other thoughts? Oh, sorry, I've already changed my screen, haven't I? Yeah, so overall, I would say that it certainly has changed, but it's not impossible, right? We still can do a presentation. We still can do an event, and it takes a little bit more effort, and maybe we don't know how many people, so we're still learning all of the things that will get us there. Marketing is still an important piece. You can still potentially have a giveaway. So for example, you'll see behind me, we have this show campaign. I hope all of you are very aware of what the show campaign is, but it's the Show Your Blazer Spirit. And even in this place of a pandemic, we have been able to give away t-shirts. If you haven't seen, there's a survey on Campus Rec that is asking a little 5-question quiz. And so we're engaging folks. It's almost like you could do this at a table where you would take this little quiz, have a brief educational conversation / activity with somebody, and then win a free shirt. And so we're doing that. And we've had hundreds of students who have finished that survey and who are coming by to pick up their shirts. If you want one of those shirts, I think the survey is still live, so you can go on there and you can take this 5-question quiz. So it still can be done, but it has certainly made it much more difficult, and it has made it. I also think one of the things is that people everything that they're getting is online. And some people are also not showing up to these events because they're not getting the free food, they're not getting the personal to person connection, and they're doing everything online. And so when you do develop a program or event, you really need to make it something that is really exciting, really engaging, something. I mean, look at how many of you are here for this training that is via Zoom, because the mental health ambassadors' mission and initiatives are important to you. Getting this training is important to you. This issue is important to you in such a way that you're willing to spend many days and hours on this training. And so this is an example of success of it being able to be done. What are the overarching goals of the mental health advocate? So what is it that this group seeks to do?
I thought of a positive for the one earlier. I thought of a positive for the slide before.
Yes.
I think that sometimes it can be very difficult to go to events during the day if you have class, because it could be far on campus or difficult for you to come there if you live off campus. And so by having things virtual, I think more people are able to participate. I know I personally am, because it's so easy to get on a computer and be with 50 people than having to try and drive across campus or drive from home or walk somewhere to get there.
Thank you so much for saying that. I agree with you. I think that we are able to reach students maybe who were not able to participate previously. We have a lot of online students who didn't come to campus and maybe didn't participate in the in-person programs, but now that there are so many programs being offered online, they may be able to participate more. So that's a great reframe of how going virtual has maybe benefited programming. Thank you for that. Okay, so when we talk about the programming of the mental health I wrote the wrong word in there, ambassadors. Double check your presentations. I said to myself earlier, I think I used the word advocate once in here, and I went through and I looked for it and I didn't see it. So I apologize for that, and I'm just going to change it right here because I can do that. The mental health ambassadors.
but they are also advocates too. So it's great. No worries at all.
Yep. And this is, kind of, it's one of those things. We're all humans, and it is what it is. When these little things happen, you just go with the flow.
There was
Exactly.
this spelling error in ambassadors. I don't know if you caught it.
Oh, no, because
That's
I
my
just typed it
favorite.
really quickly. I see it. Let me change it. In all in all full disclosure, my computer is sitting on top of my toaster oven on top of a step, so I can
Oh
stand
my
up.
word. You're doing great. You're doing great.
Ambassadors. Is that right? Is there an E there?
No.
Okay. There we go. All right. Let's get back to our slide. There we go. It's right now. So now you can all answer the question. It is spelled right and the wording is right. So what are the overarching goals in general? I don't, if there are, mission, vision, goals, kinds of things developed, it doesn't need to be verbatim for that. But in general, what's the goal of this peer-to-peer group?
To create awareness about mental health and like the stigma around it, and also to create awareness around the different types of help that people can gain that they're not really aware of.
Absolutely. Yep. Promote services, support, reduce stigma.
Elena put connecting people with the resources they need to better their mental health in the chat.
Yes. Helping people, connecting people.
Kalia Dawson said promote mental health and create a safe place for people to talk about it more.
Absolutely. A safe, supportive environment where people can feel welcomed to talk about this issue rather than any shame associated with this issue.
Sama put in the chat creating awareness about self-care. Oh, we're getting a lot now. And then Carolyn said fostering a spirit of unity among the student body. Marcy said inform people, like reminding others that people are not defined by their mental illness. A person with mental illness, using person first language. Laura Van Winkle said unconditional positive regard for people's mental health. Ella said provide peers to relate to when discussing mental health. Lots of great. Oh, Carolyn Crane said try and correct the stigmas around mental health illnesses.
Yep, absolutely. Yes. And every one of those things is basically to create change, right? Either change perception or misperception, change in terms of help-seeking behaviors, change in normalization of this. And the other thing is to impact behavior, right? Increase help-seeking behavior, decrease misperception, provide support, normalization. So all of these things are part of every overarching goal when it comes to the mental health ambassadors. And so it's important to be talking about and having a very basic understanding of behavior change as well. So I'm very quickly going to just go over these three theories: the social ecological model, stages of change, and social norms, as we talk about how do we influence people, behaviors, attitudes. So the very first one is this social ecological model. This is a very, very old, actually not that old, it's from the 80s, I think, but it really talks about how individuals are influenced by so many things that they're not always aware of, all the way up through interpersonal, which is your kind of peer group, as well as community, organizations, institutions. So let's say UAB as a whole, Birmingham as a whole, policies that are so often outside of our awareness of local policies, state policies, federal policies, institutional policies, and then the culture as a whole. So all of these things influence in an individual, and change in one area can impact change in other areas, and it can go both ways. Individuals can also affect groups and communities, policies and culture, and then it can also come from the top down. The culture, policies, communities can also go down and influence the individual. So it's this kind of two-way back and forth influence that we have in terms of influencing behaviors and influencing people. What level do peer-to-peer initiatives mostly impact? What would you say?
I would say that most likely impact interpersonal and on the interpersonal individual level the most.
Yep. Yep. So that's where we see most impact. And it says it kind of in its name, even, right? Peer to peer. You're looking at influencing this group, this peer group, but we also know that simply by being a part of a peer to peer group, you as a peer and as an individual will also be impacted. So the individual is more one-on-one conversations. So you see that oftentimes in some of those outreach activities, tabling, you're having one-on-one conversations. So you're influencing an individual at that level. And then group norms. You know, when you as a group are coming together and you're influencing other peers, when you're bringing mental health to a high visibility within the campus, you're influencing that peer norm of we care about this here at UAB. And so those are really the two levels. Now, can peer-to-peer groups influence institutions and policies? They absolutely can. But most of the work tends to be at this interpersonal peer-to-peer group level and the individual level. So that's enough about social ecological theory. I just want to kind of talk about, as you're thinking about it, are you trying to impact one person or trying to impact a group? And then stages of change theory. This is also a theory that talks about how behavior is changed. And so it's a process at which a person, pre-contemplation. So let's say a person is, somebody else has says, oh, you need to change your behavior. At pre-contemplation, they're completely unaware or uninterested in changing behavior. So they may say, there's no stigma around mental health issues, right? They're pre-contemplative. They don't believe that there's a negative issue that needs to be addressed in any way. Contemplation means that they are they decided that the behavior, maybe that there is something to be looked at here. Maybe there's some change. There might be some distress about it. And they consider changing, but they feel really ambivalent about it. And so they're just kind of not making any changes, but they maybe are a little bit more open to, oh, well, maybe there's some stigma against mental health. Preparation is where they're like, you know what, I actually think that there is some stigma. I've seen examples of people being stigmatized or dealing with stigmatization. And they're like, you know what, something should be done. Maybe I need to look at the language that I use. Maybe I need to look at my own awareness and education about this issue. And so they begin making plans for change, and they may talk with others about this issue or about how to change, but they've done nothing yet. Action is where they are implementing their plan. So they have said, you know what, I'm going to change. I'm going to increase my own knowledge. I'm going to increase my own education about this issue. And they may falter. They may have chosen that they're going to change the language in which they use that they know is toxic or stigmatizing language, but they're used to using it. And so they may falter, they may mess up, but that they're really trying to make that change throughout their entire existence and being. And then at some point they can reach maintenance where they have made that change. They are now an advocate. They are aware of how mental health is viewed in our society in negative ways, and they're actively making changes for how to increase that and provide support to that issue. And so that is this long process, and who knows how long it can take. Somebody can be in pre-contemplation for many, many years, or contemplation for many years, but somebody could also go from pre-contemplation to maintenance pretty quickly. And this is something that we talk about in all kinds of ways. If you ever think about when you've tried to have a more nutritious diet, when you tried to drink more water, when you've tried to have less screen time. There are outside variables. There are a variety of things that can interfere, with that process. But the point is that behavior change takes place over time. And one of the things that we know about really passionate groups who are trying to create change is that can be hard sometimes to not get those results right away. I know when I'm talking with groups in particular about interpersonal violence prevention and, for example, victim blaming or bystander intervention, what I want is to get somebody from maybe pre-contemplation, like straight to action. And it's important to just recognize that every little bit of information that you provide can help move people along where they need to be. And just to be, comfortable with the fact that it's a process and that it just takes time to do. So that's kind of why I wanted to talk a little bit about this pre-contemplation stages of change theory. The last theory that I want to talk about is social norms theory. And so basically what this theory states is that behavior is influenced by misperceptions of how our peers think and act. So we don't necessarily know, maybe they're based on our perception, but we don't recognize that maybe it's a misperception. And then when there's an overestimation of unhealthy or negative behaviors of our peers, that we then are more likely to engage in that problematic behavior. And that there's opportunity that if we correct the misperception, we can actually encourage participation in the healthy or positive behavior. And so social norms theory is used a lot in problematic behaviors related to alcohol and other drug use, that there's this stereotype that most university college students are drinking in high-risk ways. And yet when we collect the data, we recognize that actually there are a few, but that most actually are either not drinking or are drinking in moderation. And when we can correct that misperception and address this stereotype that's untrue, you release pressure from an individual to change the positive behavior into the negative behavior because that's what they think they should be doing. And so if we relate that to mental health, we can correct this misperception that mental health is a shameful situation or behavior, that if you are dealing with a mental health issue, or if you have family who is dealing with mental health, that the recognition is that most people probably also have someone who they love and care about who is dealing with this and do not think about it negatively. And so the more we can talk about that and the more we correct that misperception and the more we say, not me, we can change that social norm. I also think about this in terms of self-care, where people are saying, nobody has time for self-care. Everyone says to do it. But the more that we can say, you know what, I've prioritized this and this is how I prioritize that, and we can model that, then we can help influence that social norm and thereby help others say, you know what, I need to make time for this too. So those are really the only three theories that I wanted to talk about related to behavior change. I did want to open the floor though and say, what are opportunities for you guys to correct misperceptions related to mental health? So what might be some misperceptions out there that you could address with some sort of a program?
I believe there's a big misperception on that people feel like they're the only one going through it. You know, I think that's my biggest thing, and that's one of the reasons I wanted to be a mental health ambassador, so people don't think that they're all alone in these stresses. I feel like it's a big thing to showcase people's common stresses and the commonality of it, so they don't feel alone, and they can. I think that will help people talk more about it because they don't feel alone. They feel confident that other people are going through it, and it will be fine. And I think that's a big misperception that needs to be fixed.
Absolutely, I would agree. And I think that you're right. I think there is this, that social norms theory would apply to this, that people think that they are the only one. And yet, if they really knew, and if we did a good job, of saying you are not alone, the majority of individuals, are dealing with or have dealt with at some time the struggle, it can change that social norm. It corrects the misperception.
I feel like another common misperception is that depression and things like that have to look a certain way in order to be valid, and that's not necessarily true for everyone. And so it shows up differently in different people, and understanding that and accepting that can help make people feel more at peace and stuff like that.
Yes, absolutely. I think allowing room that rather than a person who is depressed they must behave certain ways, allowing them to experience that in any way that they can, and saying it doesn't look just one way, it looks many, many different ways, is changing that. And that also helps probably keep that person from feeling like what they're experiencing isn't as bad as, or isn't as important as, right? When we think about, well, it has to look this way or that way, we almost minimize an individual's experience if it doesn't look like that. And so another great example of a misperception that could be corrected.
I had two things. The first, for misconception, I think a lot of times, because it's not a visible illness in the sense of, oh, I can't tell that your arm's broken or I can see that you can't walk, people tend to perceive it as something you can just get over by yourself or you don't need help because of it. But I saw a post recently and it was like, it's like telling someone with asthma, just breathe, where, I mean, yes, that's a great plan if that's how that works, but it's not. They need an inhaler, they need respiratory therapy, they need all these additional things to help them be able to breathe and go through their day-to-day lives. And that's a lot of times how mental health can be. Just telling someone, oh yeah, well, just don't be depressed. That's a great idea, except it doesn't work. You need a treatment plan, and you may need medication, and you may need to talk to a therapist or do those different things so that way you are able to do your day-to-day life. And then the other thing is I sent a link in the group chat and people use that link to get on to this session. If you use that, your name is my name. So you need to go in and rename yourself to your actual name because you won't get credit for attending the session. I'm just being told that I am here in 4 different devices, but I'm not. I'm on one. So
yes, thank you. And I did send that in the group chat, and I think one of your friends has changed their name. So hopefully the other 3 do. And all you need to do is go hover over kind of your name, and in the top right, there's 3 dots, and you just click on it and it says rename. So it should be pretty easy. Thank you.
Yes, thank you. And thank you. So you are Melissa. Yes. Okay, good. And so thank you also though for that. That is an excellent example. A lot of people think that it's not okay to ask for help because it's not a physical ailment. And very often when anyone would ever say, if you have asthma, absolutely you need to go to the doctor, you need to get tools and resources, you need to have treatment. With mental health, there is this misperception sometimes that you wouldn't seek help as easily or as frequently. And we know that that's a misperception, that it is as valid a need for treatment as having asthma is. And asking if you have asthma and you go to the doctor, that's not a weakness. And similarly, when you have depression and you go to the doctor, that is not a weakness, you know. And so seeking help and needing treatment being as valid as any other physical ailment is a misperception that can be corrected.
Just to expound on that, I had, in order to graduate high school, I had to do a thesis, and my thesis is actually on destigmatizing mental health. And so the whole point of that was saying, like, part of it was saying that, like, mental health is just as valid as a physical illness is. And there's just, if you wanted some research behind it, there's a lot of research behind it that proves that, like, or if you needed like resources to show to people that it is actually a valid, like, if people don't believe it's actually valid, there's a lot of research out there that proves that mental illness causes stress on your body, and it's not just a thing that you say that, oh, I have depression, like, oh, like, I'm just sad. Like, no, that's not it. It causes so many other issues that you don't even really think about it until you've researched into it. But yeah, that was just an expounding upon that. So
Yes, no, thank you for that, Sarah Ann. I appreciate that too. I mean, and so you guys really can see that when you get to a place where you're putting in your program proposal, when you are brainstorming ideas, correcting misperception, there's a lot of work that can be done there in this area. And so I think that there's, you know, we've probably just scratched the surface in terms of misperceptions that are out there that exist, that work needs to be done to correct. I'm going to move on now to kind of what we were going to be talking the most about in this session is developing programs. And so the very first thing that we're going to talk about is this SMART goals. And so this is something that you're asked to do in your program proposal, is to identify your SMART goals. And so really it's just a way to make sure that you are having, you're accomplishing your goals in a deliberate fashion. So it's an acronym for specific steps. Be specific. What is it that you want to do? What is your goal? What is your objective? How will you measure success? You know, and we'll talk a lot in here about ways in which we can do assessment and what success could look like. Attainable. Is it attainable? Can you actually do what you want to do? And do you have the resources to do it? Is it relevant now? And R also sometimes stands for, what is it? Relevant, realistic. So is it both realistic, which is a part of what attainable is, but is it relevant now? And we'll talk about different things that come up at different times where maybe they're more relevant than others. For example, right now, mental health and COVID is very relevant, extremely relevant, you know, but there's lots of issues that maintain relevancy for a very long time. But then finally, what needs to be done by when? It's always good, especially in a group setting, to have a very detailed timeline of what you're going to do, also specific who's going to do what, and then a timeline based on how you're going to accomplish all of those goals. So this is just a very, very, very brief overview of what SMART goals are. Wanted to make sure that we included that when you are putting in that information in your proposal. So don't really have anything else that I'm going to say, but again, I'm going to try and incorporate it into our practice session at the end. All right, so forming programming ideas. When you get to the place where you're like, all right, we've got to do a program. What is it we're going to do? These are just a handful of ways in which you can approach that. Is there a gap or a need that needs to be addressed? You know, we just also talked about, is there a misperception that needs to be addressed? Reinforcing information. There's already a lot of information out there about promoting self-care, and yet we know we need to reinforce that information. Right? So what am I going to do that's going to maybe reinforce some information that's already out there? promoting a new service, or perhaps promoting a service that already exists, but people don't know about it. Calendar-driven topics. I call them calendar-driven topics. When working at a university, you see a cycle where students' needs are based on kind of the semester calendar. We know that when new freshman students are coming in, that there's a need for some socialization, some connection, meeting each other. And so people will do programming that may be more social in nature. We know that once we get towards midterms, we'll see an increased need for maybe study management, time management, stress management. When we get to finals, we'll see maybe there's some additional time for stress management, self-care. And so you can also base your ideas based on what you know to expect that's happening in the semester. Leaving for holidays. For some students, that isn't exciting. And being able to address that or do some programming related for how to handle the holidays when maybe it isn't healthy for them to go home. And then always any current issues that are developing are also things that you can kind of use as a springboard for programming ideas. Excuse me, I have two mouse because I've got one on my computer that I'm reading and then one on this one. So, and then another thing that helps with forming ideas is brainstorming. So brainstorming, I'm sure everyone has probably used the word or heard the word, but it really can be very, very helpful, especially for groups. When you are with your groups, really thinking through, just allowing yourself 3 to 5 minutes where you are literally brainstorming. You're like, okay, we are going to address improving or increasing mindfulness habits of students. And so you have 3 to 5 minutes where you're just throwing every idea you have down. You're just writing it all down. And if everyone in the group is doing that, you should end up with a large quantity of ideas. You're not looking for quality at this point. You're just looking for every single idea, and there's no wrong answers and there's no judging, because you're really just trying to say, okay, what are all of the things that we could potentially do? And then you start to go through in that process and you weed it out as you're further intentionally designing your program. So brainstorming is just one of the things I wanted to put out there because I really do think it can be very, very helpful. And it should be a fun activity. And the more you do it, the more you're able to come up with even more ideas for programs. And so at our end, one of the things I'm going to ask you guys to do, because you'll be a brand new group, is just to try and brainstorm with each other. And so after you brainstorm, then you start to sort through and you figure out what sticks and what doesn't. And one of the things that might come up when you're brainstorming is the type of program that you're going to do. And so the methods for conducting programs, these are what traditionally peer-to-peer outreach groups are conducting. They are usually doing social media posts and campaigns. And when I say campaigns, those are both digital campaigns as well as old school poster campaigns or those types of things. Workshops and presentations, and then events and tables. And so that's what we're going to talk about today, are those 3 types of ways or methods in which you can conduct a program. Common elements in every program, regardless of the format of the program, what should be included when you are developing a program, regardless of whether it's a social media or a table or a workshop, what should be included when planning any program? And this is kind of out to you guys. So I'm looking for some suggestions or feedback on this.
I always try to include an option that garners engagement from the audience.
Yes, something that creates engagement or an interactive activity of some sort.
Someone in the chat said, what is the audience?
You know, it really shouldn't matter on the audience. I hadn't thought about this. I was just kind of talking globally, but knowing your audience is an important piece when you are developing a program. That is for sure. And so this, I wouldn't, that's not a piece of this right now. We'll talk about knowing your audience though, 'cause that is important.
What can they take away from your presentation?
Yeah, so the impact, the goal, what is it that you're trying to do? And so what will they leave having knowledge of, having been changed by participating in?
Someone in the chat also said other resources that they can look into after the program.
Yes, I think that's really an important point, so that they've interacted with you, and then if they want to find out more information, they can go and get more information. All right, so I put some of these together, and I think you guys expanded upon that. So every program, regardless of what kind of program it is you're doing, whether it's a social media post or it is a 90-minute workshop, you should have goals. What are your goals and your objectives? You should develop a timeline for completing and implementing that program. It should always consist of credible information. You should know where you got your information so that you can then share that, and also refer folks if they want additional information. Collaborative opportunities. Not every program will include a collaboration, but you should always consider whether or not there's an opportunity for a collaboration. Collaborations tend to just increase the richness of a program as well as the depth, maybe reach audience members that wouldn't have otherwise been reached. And so we always want to encourage collaboration if possible. Engagement. How are you going to hook them? If it is a social media, what's going to make them stop and read your post? As well as marketing. If you have an event, if you're having a presentation, what's going to get them there? There's a lot, almost there should be as much time in program development in terms of content as there is in identifying how are you going to engage and market the program and get folks to then interact with you with all of the time and effort that you've put into developing the content. And then every program should have some sort of level of assessment. And assessment can look so many different ways, and there's many different levels of assessment. But basically, these are some of the common elements that every program should have, regardless of what kind of program or method of program it is that you're delivering. The other thing that is important when programming is to have a pie mindset. Being positive, inclusive, and empowering. This just helps information be received in a much better way, and it's a much more, it's just a kind of a growth way of educating people. When we're positive, meaning we tell people what to add in their life instead of take away from their life, right? So instead of saying don't be blah, 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 you say consider doing XYZ, because it's much easier to encourage the adoption of healthy behaviors, and it's a more positive way of providing encouragement and motivation than it is to say stop doing this other stuff. Inclusive, meaning inclusive of all individuals, types of people. Now, that doesn't mean you can't have a program that is focused more on a subset of a population, but we can be inclusive in lots of ways in terms of using the language that we use, the ways in which we're presenting the information, and including recognizing culture when we're promoting information. If you are hosting an event, not hosting it on a day when there may be a religious holiday, even if it's not observed by the individuals who are planning the event, those types of things. And then empowering. Empowering is how we can just simply be encouraging, motivating, examples of what to say and do. That's empowering, rather than telling people to not do something. Conveying belief in them and conveying a belief in their abilities. So between having all of these intentional goals, assessment, marketing strategies, also intentional in terms of the content that you're including so that it is positive, inclusive, and empowering. This was actually an example that I saw right from your program proposal, or excuse me, your marketing overview that was shared with me by from Destiny. And so there's already information and language encouraging you that when you are doing is this for the social marketing, I believe, when you're doing some of that, yes, that you are already having this pie mindset. So avoiding any phrases that align with toxic positivity. Just be happy, don't stress, you'll get over it. That's not being positive. That's almost minimizing. And so there's the example. These phrases minimize what someone may be experiencing with regards to their mental health, and it fails to validate their emotions. Avoid telling people what to do and instead provide suggestions. So that kind of goes along with what I was saying, which is don't tell people what to not do. You can tell them what to do, but do it through suggestion. Consider doing this, consider doing that. Instead of saying when you are stressed, go take a walk. When stressed, consider doing something relaxing, such as spending time outside. And the reason is giving suggestions to people provides them with options and gives them the power to take action. While telling someone what to do takes their power away. And I would add on that, telling somebody what not to do is judgmental. A person can feel judged for that. And so also suggesting something provides a more positive tone, while telling someone is associated with something is associated with. So I just wanted to add that, because positive, inclusive, and empowering is something that we've always included in all of the peer-to-peer programming. And we always ask our peers to be thinking about that. And so I was really excited when I saw this being included already here with the mental health ambassador. So I wanted to include that in here. All right. We're going to talk about social media, and you guys probably have way more experience with social media than I do. So I see it as a lens through how to do programming, but you probably have even more suggestions of ways in which to engage with and reach audiences. And so I hope that what you'll do is you will add to anything that I have said here in terms of suggestions and ways to do programming, because so much of our programming right now is happening on social media. I mean, 100% of the Promoters of Wellness peer education program is happening on social media. And so this is big for everybody right now. So what do we know about social media? And I threw campaigns in here too, because campaigns are very similar to social media. You might have a social media campaign, but you also might have a social media program. A campaign tends to be over a long period of time, and it can be both in digital format or paper format, or with additional giveaways. But all of the things that you're doing on your social media are happening over a long period of time. And when you look over that, you can see that it may not have a look and a feel, but in essence, it is a mental health campaign, so to speak. Social media posts tend to include very short bursts of information, 10 to 20 seconds of attention. And it's really important to think about that when you are identifying the information that you're going to include in there. What are examples of goals? What could be examples of goals for a social media program? Like, what would you be, what would you be trying to do? What would be your objective for a social media program to be?
I feel like using a social media program would help you reach a much younger audience, because especially things like Instagram and of course TikTok, your users are usually teenagers, college age kids and stuff like that. So if you're really trying to hit that target audience of your teenagers, then that would be the way to go.
Absolutely. Reaching if that's your target audience, that's where you want to be trying to reach them. So if using it to reach your target audience, which is like you said, high school, college age students. What are some other examples of goals that you might want from a social media program?
Allowing your information to be spread in a clear and concise manner. If you want to have a long discussion about a specific topic, then you can have a way for people through social media to sign up for a Zoom meeting or a presentation or something like that. But if you are able to just send out little snippets of information throughout the day that they're able to look back on and understand that's something that can stick with them, then that could be a really positive impact on their life, instead of just here's a long paragraph of text that I typed in notes and screenshot, that's going to be very overwhelming, and most people would just go past that.
Yep, absolutely. Yes. So it's getting their attention and then building education or information in little snippets of a time, or perhaps linking them, getting their attention, and then kind of making them want to click in the link in the bio or in something so that they can learn more. So it could be small doses of information, or it could be small doses of information, and then what you hope is that they actually are then going to click on something, and that would be a metric that you could measure to figure out if you're reaching your goal. So I had put in here some of the things that you talked about. Basic education, that can be a goal of a social media program. Changing perception, things that we've talked about, you can certainly do that through social media posts. Increasing awareness, whether of an issue or a service. Increasing followers, that's a very legitimate goal. A call to action, click the link, learn more, or a call to action being share your self-care tips. Providing support for followers, and entertainment. People go to social media for entertainment, and so it really is important to try and include something that has some entertainment value, and that could simply even be beautiful aesthetics. You know, you're giving information, but it's designed in such a way that it's just pleasing to the eye. That's entertainment value as well. When you're thinking about social media, you have to think about the development of that. And so that's what we talked about just now with the aesthetics, the design. You also want to figure out, are you going to have any engagement or not? And you really should, when we talk about timelines of a project, with social media, you should be thinking about a posting schedule and what exactly you're going to post and when you're going to post it. So when we talk about design, we're talking about graphics, really. What is the visual appeal? And so is your program going to include graphics? Really, the rule is less is best. You don't want too many words. You don't want it to be too busy. You can have multiple graphics in a slide, but you want them to build upon each other. So if you have 10 tips, maybe consider putting one on one graphic, 2 on another graphic, but I wouldn't do more than that, because you just want as little as possible with still getting the information across, reducing the number of words and the number of designs. Contrast and readability is really, really important. I've seen some beautiful designs, but they're just hard to read because the font is too small, or it's white lettering on a pastel background. And so you really want to pay attention to contrast and readability. If it's hard to read, people aren't going to stop to look at it. They're just going to scroll right past it. And then including people and faces is really important with Instagram in particular. So it's important to try and also not use stock photos if possible. So if you're comfortable taking a picture of yourself, or somebody else in your group is comfortable, including pictures of UAB students is going to have more likelihood of engagement than a stock photo. Videos are also really important, but they need to be super short. 30 seconds might even be too long. And you can have a video that then also has graphics paired with it, as you know. And I will say, I think people are spending, so a third of online, Forbes put something out recently that said a third of online activity is spent watching videos, and 45% of individuals watch more than an hour of video content every week. And we know that Instagram has expanded its platform to allow for more videos, similar to TikTok with the Instagram Reels. And so really consider including videos as a way to increase engagement with social media. And that could even be a teaser for what's coming up later, or a click in the bio kind of thing, so that you can increase additional interaction with social media. Talking about interaction, we really want to think about engagement. Sometimes it's absolutely fine for it to be a passive engagement. You just have some information on a graphic, and that is what we would call passive engagement, excuse me. Or you might also want to, and I would encourage you as part of, let's say you're doing a week-long social media program, to have something on some day that is active and interactive. And then finally, going live. Let me go back to active or interactive. Something that encourages some sort of the viewer to do something. So a trivia, a poll, clicking the link in the bio. And I recently went to a presentation where they talked about these additional resources: Typeform, BuzzFeed quizzes, and Kahoot. Now, Kahoot is really, I think, only for about 20 people, so it might be better in a small group or presentation setting. But there's lots of ways in which you can do a trivia. You can do a poll. That show campaign that I mentioned to you previously, what we did was we posted that on Instagram, and then we created a Google form that had the survey. And so people just went to the bio, clicked on the link, and then they were able to do an assessment. And really, it was kind of a quiz. So you can do a lot more engaging interactive activities with social media. And then going live. I think going live is a great option, but if you're going to go live, you really want to advertise it. And so that way you can build participation. You could do a booth almost if you go live and you advertise it, like in the ways in which we used to do an interactive activity on a table. You can do that using the go live option, where you advertise it, have folks come, and then once they're there, you can ask them questions, and then you can ask them basically to comment, to post a comment. So it could be something like, if you have ever, I don't know, take it, whatever it may be. I don't have a built-in example for that, but so for example, if you've ever felt blue, put a blue emoji in the comments, and they can choose whatever blue emoji they want. And then you can really get a sense of this shared experience of, yeah, there's lots of people who have felt blue before, you know? And so you can do something like that in social media as well. So, but definitely you want to market it so that hopefully you have a handful of people that are there to interact with you. Other types of active engagement, we've talked a little bit about it, is tag 3 friends. That helps build followers, post emojis if you want to comment. Sometimes people don't want to share personal information, but they might be willing to engage with you if you just say, post your favorite green emoji, you know, if you agree with this post, or post your favorite, you know, pink emoji if you like what you see. And that's a way just to have some sort of engagement. And then finally, we've already talked a little bit about this, the link in the bio, where you can link to additional services or information on a website, as well as an assessment or a link to sign up for a workshop. Somebody said that earlier. And then posting schedule. The people who are, you know, that is their area of expertise within the division that I work for, say you want to be posting at a minimum of 2 times per day. This is specifically for Instagram. The algorithm will show your posts to people more often if you are posting a minimum of 2x per day. Once in the morning, once at night, and you want to post it when you think people are available. Sometime between 9 a.m. and 12 a.m. You could probably go a little bit earlier than 9, depending on who your target audience is. And then consider a weekly flow. I think that if you have on day 1, Monday, we're just going to introduce a topic and why it's important. Tuesday, we're going to provide education. Wednesday, we'll incorporate a video. Thursday, we'll incorporate an activity. And then Friday, we'll promote resources. And you could do that kind of a schedule for multiple topics throughout multiple weeks. And that way you have this kind of flow where one builds upon the other. All right, and social media assessment. So how do we assess now? We've done all of this posting, and we don't have a paper survey. We can't, you know, get feedback based on that way. And so how are we going to do that? And you can assess anything from number of new followers, to the number of shares, to the number of clicks. You could link an actual survey in the bio, and you can say, how useful was this information? How relevant was this information? Or you can even do a quick quiz or poll right in your social media. General tips when it comes to social media is view the design on your phone first. When you're creating these things on a computer, sometimes you won't see subtle differences in the contrast, or the font will look large, but when you have it on your phone, it looks small. So always view it on your phone first before you are posting it. Ask a friend to view the post or do the activity and to provide honest feedback. Was it enjoyable? Would they have stopped and looked at it on their own feed? And then make it both educational and entertaining. We want folks to want to follow us because we're providing something of value as well as something that they just enjoy. So those are basic tips for social media. I'm aware that we are at almost 3 o'clock and we have a half hour left of the presentation. So I do want to give folks about 5 minutes and then we will just go through presentations and tabling pretty quickly and hopefully still have a few minutes at the end to do our activity. So do we want to just break for 5 minutes right now? Is that appropriate?
Sure, that sounds great.
Okay. So some presentations. This is where you tend to have your more in-depth opportunity for really providing all the information that you want. They tend to range anywhere from 30 minutes to 90 minutes, depending. This one today was a 2-hour presentation, and delivery tends to be in person or on Zoom. What are characteristics of good presentations? You guys are in classes, you guys are attending presentations. What would be some characteristics that you would say have made a presentation a good one that you've enjoyed? I'd like to hear from you.
Engagement.
Engagement. And so how have you been engaged? Like, what makes you engaged with a presentation?
When whoever the presenter is has questions that make sure the audience is following along.
Okay. Yeah. So, and thank you. I appreciate that I'm asking questions and I'm getting feedback from y'all because it helps me enjoy the presentation too. So it's both ways, I think. What else makes a presentation good?
I find adding
a bit of a, oh, my bad.
No, you're fine. You're fine. You can go ahead.
Okay, like sometimes maybe adding a bit of a personal aspect to it, maybe like a first person account of what happened, or, a personal story or an interview of some kind, because it allows you to see like, oh, this is a real thing. Like this is a real human being that this has happened to. This isn't just something I can read about.
Yes, absolutely. I think that it's important to be able to share a personal aspect within also having some sort of recognition of boundary, right? And so it's walking the line between being able to share and disclose, but recognizing that there may be some things that you wouldn't share or disclose, but definitely connecting with the presenter.
I would say maybe not having like a lot of information on these slides helps a lot, because once you see all the information, it feels kind of like an overload of what you're getting ready to be told. So even if they did have it, I would even prefer like transitions that show it one at a time, so you're still not overloaded.
Yes, we know that when you've written out sentences and you have a lot of words on PowerPoints, it actually draws attention away from the presenter, right? And so you want to be listening to what the presenter has, and then the slides are just to help, they're almost just a visual accompaniment and chunks of information. I tried to make my presentation engaging by being brightly colored, hopefully still easy to read. That was a strategy for me of just incorporating a theme of colors. So hopefully that has been received well. What are other thoughts?
I find that like if you can add in a way, like in some shape or form, add humor or something like that to also engage the audience, like memes or something that can be relatable to what you're talking about and also to the audience or the people that you are trying to reach.
Yes, I think humor goes a long way. I think including relevant, like you said, memes or something that's trending that's also, appropriate is a great way to have people enjoy, or yeah, just get something fun out of it too.
Someone mentioned being engaging by asking questions. I think it's really helpful when, like, I'm in a sorority and we have to do like recruitment training. And so sometimes we're online for 5 hours and they're really long. And so we'll go into breakout groups, or we'll do like cahoots throughout, or try to do multiple breaks or something like that, that really helps break it up. So you're not forced to, you know, kind of like sit and watch just one person talk or two people talk the entire period of time, because that can be very overwhelming for your brain and difficult to just sit there.
I love Kahoot. I think that they're really fun, a great way to just break up a slideshow. I also like polling questions, because not everybody wants to talk, but people are willing usually to participate in a poll. So I think those are good too. So yeah, a lot of really excellent information. So you're talking about, you know, you guys have really mentioned a lot of this, something that is informative, but also engaging, right? And participatory. We want information that's relevant. That's where you might bring in the meme or the pop culture reference, whatever it may be. Also something that's appropriate for the audience. If you have an audience who's coming in who is maybe this is their first time ever talking about this, you don't want to be presenting high level information. You want it to be at their knowledge level. And incorporating multimedia. If you can incorporate videos, if you can incorporate music, if you can incorporate imagery, those types of things can really help make your presentations go from dry to fly, so to speak. Goals for presentations include, like many of the things we've been talking about, but there's more opportunity potentially here for, in particular, building skills. Education is always a goal. Changing perceptions, changing behaviors can be a goal. Increasing awareness, but building skills, there's opportunity for that. And the types of presentations that we've talked about are more lecture style, where you have the expert kind of lecturing and maybe saving questions for the end. Conversational, which is more of a back and forth dialogue. And then you can even have the Q&A or panel discussions. When you are developing a presentation, there are 4 cornerstones of success. And most importantly, you just have to know yourself. What is your style? It is okay if you are the kind of person who wants to save questions for the end. You can just say that in the beginning. I'm going to go through some information. We'll have some time for questions at the end. If you're the kind of person who, when you present, you're okay for people to interrupt and ask questions all along the way, then do that. But knowing what you're comfortable with, and then you can just put it out there as soon as you start to present. Knowing your material. I cannot stress enough how important it is to know your material, to have practiced. Practicing your presentation out loud. If you're tripping over words consistently in one spot, change up what you're going to say. If you're fine to read the prompter for the PowerPoint presentation, then do that. But if you need to have index cards, create those. So that's also kind of knowing yourself and knowing your material. The more you know your material, the easier it is to deal with disruptions, because you can't control what potential disruptions may occur. And it allows you to get back on track. If you are asked a question in the middle, if you know your material and you know your flow, you'll be able to quickly figure out where your next place is that you need to be, so that you can pick up and continue to move forward. And knowing your material includes knowing where you got your information from, so that if somebody is like, oh, well, where did you get that from? You know, you can say, oh, actually, that comes from NAMI, the National Association of Mental Illness, I think, or SAMHSA, you know, so you can say where you got that information from and that it's credible. Know your audience. Are they there voluntarily? They want to be there or not? If if it's a requirement that they attend, you want to start building rapport with them early on. You want to be incorporating things like humor, like relevant pop culture, because that helps them be like, okay, I have to be here, but it's not going to be that bad. So as early as possible, if you can build rapport. If they are there voluntarily, then you can just really use some of that that motivation that they've already brought with them to have a really good, rich, engaging discussion. And then finally, knowing your purpose, keeping in mind what your goal is and what you're trying to achieve. Are you trying to change perceptions or attitudes? Are you trying to motivate a certain behavior? Keep that in mind as you're crafting your material and your speaking points and how you steer the conversation that occurs during the presentation. There are specific parts of your presentation as well. Making space, your delivery, when you deliver the presentation, and then when you conclude the presentation. Making space is that warm-up period. It's that beginning. And especially when you're talking about sensitive topics like mental health, like what I tend to focus on, interpersonal violence or substance use. And so you need to set sometimes some ground rules in there so that it creates a safe opportunity. And that's your first activity, your first exercise in getting folks on board and creating that safe environment for folks. Maybe doing something like a warm-up or some icebreaker that's kind of quick, where people can start to just, it loosens their tongues, it gets their dialogue going a little bit. And then inviting participation. This is the time in which, while through doing these things, you're inviting them, you're asking them to please participate with me, rather than this being this one-way delivery of information. When you do get into delivery, when you are, you're ready, that's the bulk, that's the meat and potatoes of your presentation. You want to make sure that you are pacing the conversation though. Sometimes though, you need to be flexible. Maybe you have to spend more time talking about one area of the presentation than you had planned, because that's what's relevant to that group at that time. There's additional questions or conversations. So being able to adapt and be flexible in covering the material. Like, for example, me today, I am realizing that we've had really good engagement. I've asked some questions. I wasn't sure if I was going to get a lot of answers. And so more time was spent on that. And I'm glad about that. But what that means is I'm going to need to modify the end of this presentation. And I'm okay with that. I feel like even if we don't get through it all, you guys have gotten a whole lot of information in here. And I appreciated that conversation. I appreciated that dialogue. So I'm going to be flexible. And when we get to the end, summarizing, if possible, not everything needs to have a summary, but if you feel like these are the 3 most important points I want people to take away, summarize that. Say, if you didn't get anything from this presentation, I hope you learned how to support a friend who's struggling, or whatever those things are that you really want to be their takeaways. Thank your audience for participating, for talking with you. Always ask if there's additional questions or stay after. And then, like we talked about with everything, assessing. And assessing, there's a variety of ways in which you can also, but typically we tend to do those in person or like today with a link that people can fill out. We talked about this too earlier. What makes a good presentation? Less is best. Don't have every word you're going to say on the screen. If you do have graphs, you want them to fill up the entire screen, because those numbers can be really small. So if you're presenting data points on a graph, make it as large as possible. Same thing with your font. You want your font to be large as well so that people can see. And that also helps take up the space for the visual display, because you hopefully shouldn't have as many words on the presentation. And then always, again, just like with social media, be aware of your contrast. You do not want somebody who's sitting in the back row or if the lighting isn't good to not be able to see the presentation. Making a presentation interactive is really important. So ways in which, here are some different methods of doing that. Small group breakouts, and you can do that on Zoom as well. Open-ended questions. I did a lot of that in here today. Skill building goes along with role play. So these are ways in which you can try to have somebody engage in something. So for example, let's say you are trying to encourage how to support a friend. Give an example and ask them to role play how they could respond to do that. And that really can help increase self-efficacy, a person's confidence in their ability to be able to do that because they've practiced it. So that is a great way to increase skill. You can have them do worksheets that you do, or for example, you could do trivias or quizzes or Kahoot. And depending on the topic, for panels, a lot of times you can submit anonymous questions, but I also used to do at my previous institution, we did a lot of sexual health education, and people did have a lot of questions about that, but they weren't comfortable asking that in a group format. And so we would just have index cards that they could write anonymous questions on so that we could answer those throughout, because again, we wanted the information to be relevant. And then they felt involved. Assessment. You do have an opportunity with the presentation, I think, to do a little bit more of an in-depth assessment. And that can be delivered if it's an in-person at some point in time, a paper survey, or online, a link to a survey. Kahoot is able to do assessment, but it would tend to be more of a brief assessment. And the kinds of things that you would be considering assessing are knowledge, attitudes, behaviors. I will say in a presentation, you may have more of an opportunity, if you want, to do a pre and post assessment as well. As people, before they start learning the information, you could kind of see where they are in terms of their knowledge or attitudes. Behaviors won't change in that time, but knowledge and attitude can. And then you could assess afterwards to find out, did you have any impact in their knowledge or attitudes? Same thing with self-efficacy. Did you increase their confidence in whatever behavior, or their understanding about how to do something? So those things can be assessed if you want to build in a pre and a post, but you don't have to. You can also just ask reflectively, did participation in this increase your confidence in being able to support a friend? Right? And they could say, yes, it did, or no, it didn't, or neutral, but you can at least get a little bit more in-depth information. I think it's always important to assess satisfaction. Did you enjoy the presentation? Was it relevant for you? Was it applicable to your life? Did the presenter do a good job? And so when we're doing more of these workshops and presentations, those would be the kinds of things that I think I would be encouraging you to include when you're doing your assessment. All right, okay, here we go. And then tips. You heard me say this before, practice, practice, practice. Public speaking is something that does take practice. Being able to go through the flow of a presentation takes practice. And so the more you say it, and not just in your head, the better. Say it out loud. Say it to your cat or your dog or the mirror or your friend, whoever it may be, but say it out loud. I think it really makes a difference. If you're tag teaming this, assign slides. Just know from the get-go exactly which slides are yours, but go ahead and be familiar with the other content in case you have to rescue your friend, your co-presenter. Maybe they are having a bad day, or maybe they're sick, or whatever it may be. So be aware of what those other slides are, but really have ownership over your slides. Have a checklist of materials. If you're doing an activity, make sure that you have everything you need to do that activity. And this is more applicable when it comes to being in person. But again, if, like, for example, today, if you're going to have a Zoom poll, you now know that if somebody else is hosting the link, you cannot have that Zoom poll. You have to have time to do that ahead of time. And so that would be a part of your preparation checklist. Arrive early so that you can test out your multimedia. If you have a video, to check it out. If you're doing a poll, to make sure that it's working. And then if you are going to a physical location and your slides are living on the web, you'll have a USB backup, because you just never know what kind of technological difficulties can arise. And so those are just some general tips to help make sure that your presentation can go as smooth as possible. I'm not going to talk about tabling. We only have a few minutes left, and I'm aware that there's some announcements that need to be made. And so I'm just going to go ahead and kind of say thank you so much. I appreciated this time with you. I really look forward to seeing the kinds of programs that you guys are going to be doing. I hope that you'll reach out to Wellness Promotion and the PAL peer educators if there's anything that we can collaborate with you on. And I appreciate all of y'all being here voluntarily on a Friday afternoon when the sun has finally started to shine. So I just thank you for that.